Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today. In this episode, I will present a study titled Fasting versus a Heart-Healthy Diet Before Cardiac Catheterization, a randomized controlled trial. This was published in the American Journal of Critical Care on January 1, 2024. The first author is Carrie Woods, MBA, MSN, RN, a nursing manager at the Parkview Heart Institute, Fort Wayne, Indiana, USA. Background: traditionally, patients undergoing cardiac catheterization, a minimally invasive procedure to diagnose and treat heart conditions, are instructed to fast for at least 6 hours before the procedure. However, there's little evidence to support this practice, leading to discomfort and potential negative effects. Objective: this study aimed to determine the best practice for fasting requirements before cardiac catheterization by comparing two groups, one following the standard fasting protocol and another allowed to eat a heart-healthy diet until the procedure. Methods: researchers randomly assigned 197 patients scheduled for elective cardiac catheterization at a U.S. Heart Institute into two groups. The heart-healthy diet group could eat specified low-acid meals until the procedure, while the fasting group followed the standard no food or drink after midnight protocol. Both groups received their medications with sips of water. They then compared patient satisfaction, thirst, hunger, and potential complications after the procedure. Results: patients in the heart-healthy diet group reported significantly higher satisfaction with the pre-procedure experience, experiencing less thirst and hunger before and after the procedure. Importantly, no safety concerns emerged. No patients in either group experienced pneumonia, aspiration, intubation, or hypoglycemia. Additionally, the group's fatigue, glucose levels, gastrointestinal issues, and medication requirements remained similar. Conclusions: allowing patients to eat a heart-healthy diet before elective cardiac catheterization did not pose any safety risks and significantly improved patient satisfaction and overall care experience. This study suggests that traditional fasting may be unnecessary and potentially detrimental, paving the way for new guidelines allowing patients to eat before similar procedures using conscious sedation. Implications: this research challenges the long-held practice of pre-procedure fasting and offers a more patient-centered approach. It paves the way for further research and potentially changing clinical guidelines, improving patient comfort and potentially reducing pre-procedure anxiety without compromising safety. This study challenges the traditional practice of fasting before cardiac catheterization, suggesting that allowing patients to eat up to the procedure does not increase the risk of adverse events. This small, single-center study found no post-procedural complications in either group, and patients not fasting reported higher satisfaction levels due to reduced hunger and thirst. The authors emphasize prioritizing patient comfort and satisfaction, encouraging a re-evaluation of guidelines by professional societies. The study prompts a shift in fasting practices at the study center, with potential wider implications for other procedural situations. Experts advocate for larger studies to validate these findings and reconsider fasting protocols.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.